The Nigerian Medical Association has revealed that the country has a deficit of 315,426 medical doctors to cater to the health needs of its over 200 million people. According to the NMA, Nigeria's ratio of 1 doctor to 5,000 patients falls short of the World Health Organization recommended ratio of doctors to patients in the country, which should be 1 doctor to 600 patients. Using the latest United Nations population data for Nigeria, which is pegged at 215 million and 63,351, the NMA revealed that there are 43,013 doctors available to attend to all Nigerians, leaving a huge deficit of 315,426 medical doctors. To discuss the implication of this on the country's health sector, we have in the studio a medical doctor, Dr. Najib Usman, who will give us more insight on this. Thank you for joining us on Daybreak.
Thank you so much.
Yes. Let me start by a more generalistic approach to this discussion, which is your assessment of the country's health sector as it regards the number of medical doctors we have.
Okay. Thank you so much. To be honest, we are in a very pathetic situation. This is a country of 200 million people with just less than 30,000 doctors practicing in Nigeria. If you look at the MDCN, which is the Medical and Dental Council of Nigeria, on its register, there are about 80,000 doctors. But the number that is practicing in Nigeria is 30,000 or less. And week in, week out, every week, we are losing doctors. On average, every week, 10 doctors leave Nigeria for UK. This is the reality. And the thing is, when these doctors leave Nigeria, Nigeria is losing. We lose money. Money in terms of the money that is invested in the trainings, and then money in terms of medical tourism. The Nigerian budget in 2022 for health sector is just 4%. That's about 700 billion naira. And annually, the amount that Nigerians spend on medical tourism is more than 650 billion naira. So just imagine, the country is spending 700 billion, and then Nigerians are exporting 650 billion to other countries.
So, why do you think that that's the case? Is it with the infrastructure? Is it with the health infrastructure? Or is it with the issue of lack of specialists that will attend to certain issues health-wise?
Well, for specialists, we have the specialists. But let's talk about infrastructure. It's not there. We don't have it. The working environment is not encouraging. You see, the joy of any health care professional is to see a patient, offer your services, and then the patient should be back on his or her feet. That is the joy. That's all what we want. But just imagine a scenario whereby someone made it to the hospital, maybe an emergency unit, but the doctor is helpless. There's nothing he can do. The most basic of...
When you place the training
yes.
that you get, and the kind of things that you need, or the kind of things that you are shown during your training that you need to use,
yes.
While doing your job, and you look at what's on the ground,
yes.
in reality in the hospitals,
yes.
how balanced is that?
Well, it's not balanced. Although you see, even during the trainings, doctors and other healthcare professionals are taught how to improvise. 80% of what we do in the hospitals is just improvising. We just improvise. But it has come to a point where even to improvise is becoming very difficult, because to improvise, there are some basic things that you need.
Doctor,
yes,
a lot of Nigerians will agree with you that there is infrastructural deficit in some hospitals and all of that. Yes. But other sectors of the economy, other sectors of Nigeria also have this infrastructural deficit. But we don't see people, professionals in that sector, live in the country. So is that really the only reason why doctors are leaving? Because we also do know that we have heard reports where some doctors don't want to even be posted to rural areas. You know, yeah. So is it just because of this lack of infrastructure that doctors are leaving?
Well, infrastructure is one of the key factors. And then apart from that, there are other factors. But you see, it all comes back to the infrastructure. Okay, the other thing is the issue of getting the right skills. As a doctor or as a medical professional, you want to be trained, because it's a training, it's a process. So, and then as a doctor or as a medical professional, you don't stop learning, because every day we can just come up with a new disease. You just have to keep on learning. And that's something that is missing. You know, that support, we don't have it here. So most of the times, you see that the medical professionals would be so helpless to the extent that there's nothing they can do. If we look at the rural maybe areas, even in the cities, we're having issues. You go to a hospital, a general hospital, something as basic as an oxygen cylinder is not there. That's one of the most basic. I have seen patients that have lost their lives because there is no oxygen, which is one of the most basic things that should be available in the hospital. So, and then when you treat patients, or when you see patients and then the patient keep on dying, you become demoralized, you know. Depression will set in. So those are the kind of things. It's not about the money. You know, people who talk about the money, the remuneration. No, that is not it. It's not about the money.
It's not because the grass is greener at the other side.
That's not the reason. Because whoever is studying any health course, whoever is going into this practice, he or she knows that this is not a profession where you make money. We are not in it for the money. We are in it because of the passion we have for the profession. But when the basic things that you need are not available, you see that the passion will be dying out. That is the reason why you see many health professionals leaving the health sector, going to other sectors. They will be in business, they will be in policy and other things.
Okay, why do you think that our health sector is in such a bad shape? Is it issue of budgetary allocation, or is it issue of corruption? Like we hear about, you know, billions. You mentioned yes. earlier how we have 700 billion naira and the rest of them. To be fair to the government, if you look at that amount, is one of the highest in, you know, if you compare, you know, other sectors in the country. So we have that kind of budgetary allocation.
Yes.
But would you say that that's not enough, or is a problem of corruption how that is not trickling down, you know, to where it's needed?
Okay. In 2001, that's what we call the Abuja Declaration. The head of state of the African Union came together and agreed that for each and every member country, they will be allocating at least 15% of their budget to health sector. For the past 4 years, we have consistently been at 4%. Remember, there was COVID. When COVID came, it was a different story. The devastation. We all witnessed what happened. So talk about 50. This is the recommended is 15%. We're not even off the 10. We're talking about 4%.
But it's the same with the educational sector
yeah.
also.
And
there's a percentage that is required by UNESCO as well.
And that's the reason why we are in the mess we are. Just look at ASU. ASU has been on strike for how many months? And then some of the lecturers are now leaving. They're also leaving.
Well, the Minister of Health says that every year Nigeria produces about 2,000 to 3,000 doctors, and that the number of people that leave yearly is not up to 1,000. So that as those people are leaving, the people that the universities are producing come in, and so it balances out. Do you agree with that?
Well, I don't know where the minister is getting his own figures, but let's talk basic. Okay. In 2020, because of the COVID-19, no doctor was graduated. And this is 2022. So for 2021 and 2022 session, no doctor will be graduated because of the strike. So let's assume that we are producing 1,000 as he said, or 2,000 as he said. Now for 2 years, 2 consecutive years, we are not able to produce any doctor. So where do you fill up that kind of gap? And then the number of people that are living, like I said, on the MDC register, we have 80,000. And then the ones that are processing is just 30,000. And then when you talk about the people that are living, we are talking about people that have done their NYSC, don't have their house job, you know, people that have started, they have experience in the sector. You can't just graduate today and then start practicing. You have to go through another process. So we are losing people that have experience, people that specialists. We are losing them.
Yeah, that brings me back to what the minister also said. He said that they are working on a one-for-one policy whereby when one doctor leaves, another one is taken. When one nurse leaves, another one is taken. But then an expert said that, how do you replace a doctor of 15 years, a doctor that has 15 years experience with a graduate that comes in? So I'd like you to speak to that.
The thing is, you see, in medicine and in healthcare profession, experience is key. So someone that has been in the profession for 15 or 20 years is leaving. And then you get someone that just graduated from the university and say replace him. It's not working. We have come to the extent that medical students, before they even write their final exam in Nigerian universities, have started applying for license in other countries. That is the reality. Because they want to go there and specialize.
But should that be the case? Because those ones are still in school. You won't say that they have come out and have faced the situation in the hospitals where there's lack of equipment and all of that. That means that those ones already made up their minds not to practice in Nigeria.
It's not that they have made up their minds. Our trainings are done in hospitals. We learn from others. You have seen your elders, your senior colleagues. You have seen the troubles they are going through. Why will you stay? You see, depression, the number of doctors that are coming down with depression, suicidal attempts is high. We just don't talk about it. But we have heard of instances where doctors and healthcare professionals kill themselves, commit suicide. So the reality is this. We are in a country whereby a lot of things are not working. We understand that. But there are some things that are supposed to work. At least we're talking about life and death situation. And then when we look at corruption, the budgetary allocation is 4%, but in reality what we have is maybe less than 2%. That is it. So corruption, poor infrastructure, lack of good working environment, poor remuneration, those are the things that are making people to leave.
Okay, there are those who say that, look, Nigeria, no doubt, is in a difficult situation right now. It's in a deep mess right now. And we need patriotic citizens that will salvage the country. So some are saying, where is the patriotism of some of the doctors that have been trained in our institutions at a very, low cost, institutions that are heavily subsidized by government and the rest of them? Others argue that, isn't it time, isn't this an opportunity for these doctors to pay back, to do some kind of selfless service? Earlier you mentioned issue of passion and all of that. So where you find doctors having issue of remuneration as excuse for leaving the country, what would you say to that?
Well, to be honest, I think doctors or healthcare professionals are the most patriotic Nigerians. We're very patriotic, very selfless. We're not in it for the money. We're in it to just serve humanity. And that's why our oath, we saw an oath to protect life, to help life, to help the sick, the needy. That's just it. So when we talk about
can that be said really about all doctors?
Yes, that's what we swear an oath to. And
that's the oath. That's the oath. But is that the reality?
That's the reality. That's the reality.
The issues.
That's the reality. But understand the situation. Like we said, as a doctor, as a healthcare professional, you shall do no harm. So when someone comes to you, and then there's nothing you can do, you're doing harm. So that's the reason why sometimes you have to leave. Go and help humanity. Go to other places that value your skills, that need your services.
But when
also,
you leave,
and then,
but when you leave Nigeria,
yes,
where the doctors are not enough,
yes,
are you not doing harm?
We're not.
Because you are leaving a vulnerable group of people without any doctor.
You see, the worst harm you can do to a system like the health profession is for you to see someone and then to not do anything. That's the worst you can do. You see, saving a life anywhere in the world is a life. You are here in Nigeria. Let me tell you a scenario, something that I also witnessed. Someone walked to the emergency room with just some mild conditions. The anesthesiologist is not available. Of course, it's a specialty. It's not available. The most basic of things that we need are not there. And then we tried all we could, but we lost the patient. It was a very sad day. I know of a doctor that was practicing in Nyobi for 5 years. He has been there, working for almost 14 or 15 hours a day. He had an accident. He couldn't pay for his own medical bills. He couldn't, and we lost him.
All right, but
we lost him.
As a doctor?
Yes, as a doctor, we lost him.
But some persons are saying that
yes,
doctors are leaving because they believe that they'll get a better deal outside.
Okay.
Because if they didn't think that way, they would stay in Nigeria and continue to engage the government to see how things can be better. Don't you think so?
Doctors have been engaging the government. The Association of Resident Doctors recently issued an ultimatum to the government. You know, the doctors have been in, in talks with the government. But the issue is implementation. The one-for-one policy advocated by the minister, this is something that has been in the pipeline for almost 2 years now. So the more we have this administrative bureaucracies, the more we delay any intervention, the messier the problem becomes. So maybe at the end of the day, after maybe all the negotiation and the rest, instead of maybe replacing 2 or 10 doctors, you will end up having a deficit of 100 doctors. Where do you come with that number? So to be honest, it's not about the money. We are not in it for the money. Most of the doctors, when they travel abroad, maybe it is practiced in other countries, they are there because of the skills. They want to get the skills. They want to have access to an enabling environment, an environment whereby when they intervene in anyone's life, they will see the impact and then they will be happy. That's just what we want.
All right, we'll take a short breather now, and then when we return, we'll continue our discussion on this, the Japa syndrome, what Nigerians call. Please stay with us.
Every patriotic Nigerian should hear this. Any politician who means well for the people will never allow themselves or their supporters to engage in any violent, destructive activities. No politician who truly wants to serve the people and develop the nation will encourage his followers to destroy properties or take human lives before, during, or after the elections. The Nigerian public must watch out for these traits and isolate any politician who encourages supporters to engage in violence. No genuine politician or patriot will cause trouble and seek to destroy the very society which they aspire to lead or develop. Politicians who have the good of the people at heart will not allow themselves or their followers to engage in violence, destruction of properties, and then taking of lives. Be vigilant. By their words you shall know them. Shun violence. Stay away from politicians who want you to do so. Let's join hands to make the 2023 elections peaceful. This message is from the National Orientation Agency, NORA.
All right, welcome back. We're still with Dr. Majid. So we're talking, before we went on the break, we're talking about flight of doctors from Nigeria. And now I want to take you to the issue of the rural areas.
Yeah.
There have always been reports of doctors declining posting to rural areas. I would like you to speak to that.
Well, it's so unfortunate, to be honest. Doctors are supposed to practice wherever they are posted. But understand that it's a system, and then we have tiers, like it's a categorized system. There's the tertiary facility, and then you come to the secondary, and then the primary facilities. Most of what you have in the villages or rural areas are primary healthcare centers. And then those centers are designed not to be manned by doctors, the basic PHC. And then we have the comprehensive, which are supposed to be manned by a medical officer of health. That is someone who has done his housemanship and then has done his post-NYSC doctor, let's just call it that. So they're supposed to be manned by that. But how many do we have? You see, the thing is, I know of people who practice in the rural areas. Of course, I know some of them. And then there are people that, of course, declined those kind of postings. Sometimes, you see, as bad as it is in the urban area, it's worst in the rural area. So when people are complaining of lack of infrastructure, lack of needed medical equipment in the urban area, just imagine the situation in the rural area. So most of what we do is the primary healthcare facilities are manned by the community health extension workers and other people. And then their own job is just to identify basic things, offer basic treatment for things like malaria, typhoid, those kind of things. And if there's any need for doctor's intervention, they can refer. That's what the system. We have to rationalize. We have to ration resources.
But is that the ideal? Should we only have national? I mean, should we only have primary health cares, at the rural level? Shouldn't we have, hospitals, proper hospitals at those levels?
And that's one of the things we have been telling the government. Let's have these infrastructures. Let's have these hospitals in the rural area so that at least people can go there and practice.
Do you know that?
Like we said, this is a profession that needs training and retraining.
Due to lack of adequate doctors in the rural areas,
Yes.
the maternal death rate is still very high, despite introduction of technology and all of that.
Yes.
Does that bother the enemy, members of the enemy?
It bothers us. Having mortality rate of about, like, we don't want anyone to die. That's the reality, like I said. And it's a very high thing. Having a very high maternal mortality rate is something that bothers each and every one of us, because some of us are fathers, we have wives, we have sisters, we are family men, so we know the pain. And that's the reason why most of the interventions, most of what the government does is in the urban area, because they're the referral centers. People from villages, from rural areas are referred to maybe a general hospital or any or a comprehensive hospital in town, or maybe in a local government area. So the number of doctors we have is not enough.
All right.
30,000 doctors. If you say, okay, in Nigeria we have 774 local governments. So divide that number, 30,000 by 774.
Yeah,
so it's not.
Yeah, we saw a report that said that Nigeria has a ratio of 1 doctor to 4,000, between 4,000 and 5,000, instead of the WHO recommended 1 doctor to 600 persons. But how much of infrastructure can government make available to keep the doctors at home? Because that in itself is relative.
Yes. Yeah, it is. But what we need is just a working environment. An environment that is working. A hospital that is functional. Not what we have now. An empty hospital, where the most basic things are not available. That's what we need. See, in the 2022 budget, there's this report I read somewhere that the budgetary allocation to the State House Clinic, which of course we know no one goes there, is more than the budgetary allocation to all our teaching hospitals combined. At a point, we had the First Lady complaining that the basic equipment needed in the State House Clinic are not there. So just imagine this kind of scenario, the situation we are in.
What must Nigeria do to be able to bridge this gap, this deficit that we have? What will it take us to be able to have as much as we need in terms of manpower?
What we need is simple. Let's implement the Abuja Declaration, or at least try to improve on what we are now, where we are now. The Abuja Declaration is 15% of the budget allocated to healthcare. Let's implement that, and then you will see the progress we will make. Because the money will go into trainings, it will go into building infrastructure, it will go into equipping our hospitals. So when we have that, people will not leave.
Do we have enough training institutions for medical personnel in Nigeria?
We don't. We don't. For a country of 200 million, as the minister said, based on his own figures, producing 1,000 to 3,000 doctors, 1,000 to 3,000 doctors every year is not encouraging. Mind you, we have a deficit of more than 300,000 doctors. That's the deficit. More than 300,000.
How many will we need to produce every year to be able to bridge that?
So you see, based on what the minister is saying, at the current rate, it will take us like 200, 300 years to bridge that gap. That's just the meaning.
But, Doctor, you also know that there's a general problem with the economy of the country.
Yes.
So what if the government is unable to implement the Abuja Declaration at this point because of lack of adequate funds? What can it do? What percentage of it can it do to at least manage the situation?
You see, there are other countries. Some countries have practiced that, like the 15% is a recommendation. And we are currently at 4%. That's less than 1/3 of the recommended percentage. So let's improve that. 10%, 4%, something better than this. And then when we improve it, let's make sure that most of the money is going into capital expenditure.
But the money is just not there. That's the impression that we get from government. I mean, this morning we are seeing the budgetary proposal for 2023, and we have a deficit of 11 trillion. Right?
So now, just imagine now, okay, the budget is, the amount of money that Nigerians are spending on medical tourism is 650 billion. This is something that we can trap here, we can use it here. 650 billion. So the government may not be able to finance it, fine, but the government can go into PPP, private-public partnership. That's something that government can look into. It's not bad. It's not people to be traveling to Egypt, India, you know, to spend money on medical tourism. We can get similar thing here.
You know,
establish similar thing, and then we need that political will.
Okay, you know,
for the government,
yes. Considering to the fact that we have infrastructural problems in our healthcare systems.
Yes.
Is it as bad, such that it warrants the kind of medical tourism that we see happens, or is it the problem of lack of confidence on our own health institutions in Nigeria?
Okay, let me ask you a question. You see, if you want to improve a system, you have to lead by example. How many of our leaders do go to hospital in Nigeria? People that have access to the best of healthcare in Nigeria don't go to hospital in Nigeria. They leave. Why? Because they know that the system is collapsed. They know that the basic machines, equipment needed are not there. So they leave. So just imagine that kind of
situation. But you said
so,
they have best of medical...
That's it. People that have access to the best of facilities here in Nigeria, they know that what they have here in Nigeria is not up to...
Okay, what is considered best
what
here?
Is considered best? What's considered best here? It's not the ideal. So they go to other countries where they think they won't get the ideal. That is just it. So in a situation whereby, maybe if there was a time I was reading in one of the newspapers that the president has gone to UK for ear infection. How many ENT specialists do we have in Nigeria? Many. But the president doesn't have confidence in his own health system. And he has to leave Nigeria. So what do you tell other Nigerians?
Well, that's a sad one. Unfortunately,
and
we have
food
to
for
end.
Thought.
Yes, it's a food for thought and a place for us to end the discussion.